Hello, everybody. Welcome to another wonderful episode of Nurse to Health, brought to you by the Hofstra Northwell School of Nursing and Physician Assistant Studies, with the always wonderful support of John Mullen, our amazing studio manager and engineer. We have a wonderful guest that I'll tell you about in a second. But first, welcome my co-host, Kareem,
Hi,
Dr.
everyone.
Kareem Nugdalla. How are you?
Good.
We are really lucky and privileged and honored to have with us Professor Dr. David Elkowitz from the Northwell Zucker School of Medicine right here on campus. We'll talk a little bit about that school maybe and his role over there, because he is really a very cherished member of the faculty over there, and I say that, and Kareem is nodding his head.
Absolutely.
From personal experience. He's acted as a wonderful mentor, not just to many other people, but to us, the two of us. We'll say thank you for that publicly and on air. But the focus is going to be really on Dr. Elkowitz's own experience, not so much as a physician or pathologist, which is his background, when the tables have been turned, and literally in this case it's the examining room table, just being on the other side of the hospital bed, let's say, because he's had his own experiences that we're going to delve into and he's going to share. And I think we'll get into a bunch of other stuff, hopefully how his, and I say this because I know you, we've talked about this, your spiritual support, you're very involved with Joel Osteen down in Texas. That's a major part, and obviously your family, probably your interest in NASCAR has probably gotten through many a tough moment as well. So we'll talk about all that. But first, let me have you introduce yourself. How did you get to Hofstra, and how did you transition from being a doctor to your role as an educator? And then we'll talk about your role as a patient.
First, it's so nice to see you, Bob. We've been colleagues for just more than a few years now, right? Going back to 2018, 2019, at the medical school, now at the nursing school. And Kareem, it goes without saying how thrilled I am to see you. I remember you as a student, first-year student.
Yep.
And now you're not only a clinician, but a professor. And but I've always enjoyed being with you, and you have such a great attitude and such a great outlook on life. So I'm thrilled to be sitting here next to you. As far as, my path, I'm a pathologist, a surgical pathologist. Did my training over at North Shore, did a 4-year anatomic pathology residency and a 2-year surgical pathology fellowship. Worked over there at North Shore, and I was recruited, make a very long story short, was recruited to go back to my alma mater. At that time it was called NICOM, now it's New York Tech College of Osteopathic Medicine. I became faculty there, ran their pathology curriculum. I did that for 6, 7, 8 years. I found out that Hofstra was opening up their own medical school. The curriculum was very unique, and it kind of fit right into what I was doing over at NICOM in running the problem-based curriculum. So Hofstra essentially announced that they were going to do a case-based, problem-based curriculum, met with some of the leadership, including Dr. Smith, back in 2010, I think it was. The rest is history. Been on faculty here, essentially facilitating in our problem-based, case-based model, facilitating in our structure labs, lecturing, being a good role model, and then, consulting for other medical schools and our nursing school here. I had just a really wonderful career and very, very blessed and thankful.
Yeah, and when you say the rest is history, I mean, it's a very successful history. I mean, without going into all the metrics and numbers and stuff, I mean, it's still a fairly new school, but it's a top-ranked national school at this point.
Mm-hmm.
And a lot of that is because of its unique curriculum, and a lot of that's because of what we've talked about this before on this podcast, the PEARLS. I always forget the acronym. I know you know it, but I'm always amazed that Kareem remembers it. What does it stand for?
Patient
Kareem?
Explorations and Active Reasoning and Learning Synthesis.
Do you want to talk about PEARLS? I know you've.
Well, I mean, Dr.
and also the axioms, the many axioms that
you're known by many to be the godfather of PEARLS, right? So, how did you come to PEARLS? Like, how was it formed in the first place? I mean, we had Kathy Gallo on here, and she kind of told us how PEARLS was adopted in the nursing school, but how was it adopted in the med school?
Case-based and problem-based curricula have been around in medical education for, more than 40, 50 years. So we didn't invent it. I like to say we perfected it, but we didn't invent it. I ran a problem-based curriculum over at NICOM with great success. The leadership and the vision and the mission of the school kind of dovetailed nicely into the case-based, problem-based model. it's one thing to have a dream, and it's another thing to implement. I had I still do a wonderful team at that time, Samara Ginsburg, and I essentially worked through how this process was going to look, training up faculty, and essentially training students not to memorize information, but kind of to learn how to learn, to be lifelong learners, students to kind of figure out leadership skills, communication skills, all that stuff that, connects patients with their healthcare provider. That's what really the mission of Pearls is. The question is why? We're going to talk a little bit about cancer and other things later. But, when I was going to medical school, the stuff that I learned about cancer and all sorts of other diseases is just flat out wrong now. I mean, just wrong. So what are we doing? We don't want to have our students memorize wrong information or information that's going to be proven wrong 10 years from now. We want our students to be good reflectors, to be good self-assessors, to be show a certain degree of humility, to look for help when they need to, but essentially stay curious and be good lifelong learners. They do that in Pearls, right? That's part of the curriculum, and it's a 2-year longitudinal experience that has proven to be successful. I mean, you mentioned metrics. We're very proud of what we've accomplished over at the medical school. And, I can speak for myself. I'm very proud of what you accomplished over at the nursing school because essentially I had the privilege to work with you for many years and your faculty, you as a student, but your faculty beforehand for 2 or 3 years. 5 o'clock afternoon meetings, kind of, thinking about how this was going to look for nursing students, for graduate nursing students. And, it speaks for itself. We're very, very proud of you guys and what you guys accomplished over there. And we're always happy to help you guys.
And, listen, I mean, the reality is you over at the med school and you especially very much paved the way. And we still try to, actively model ourselves off of you guys. I mean, Kareem can validate that. But you mentioned sort of being a lifelong learner. Pearls very much is not just about didactic learning of stuff like material, but it's about the process. Talk about trust the process. And that process weaves into and integrates with what it means to be a top-notch and humane and empathetic healthcare provider. And, so that sort of segues us in to the role that we're probably, we're going to focus most of the podcast on. Mm-hmm. You've had your role as a clinician, as a pathologist, and you've had your role as a teacher, and you still have that role. But now we're going to focus a little bit on your role as a patient. Mm-hmm. And, before we got started, we were sitting outside, and, you mentioned something that really struck me, that when you go to get checkups and various treatments, you take off your doctor hat, mm-hmm. and you very much put on your patient hat and become a patient. Could you talk about that?
This can only happen to a pathologist. So for those who don't know, pathologists, surgical pathologists, anatomic pathologists are the doctors that essentially diagnose tissue and figure out what disease is, right? So in other words, they're the ones who are diagnosing all the biopsies for cancer and all sorts of other diseases. And so that's how I was trained. And so in 2017, and this is out there, I share this with all of my students, completely transparent with them and my colleagues. But in 2017, I was standing out on my daughter's lacrosse field on my 50th birthday, and I noticed that my hands were turning colors. And I had a very, very long history of tobacco use from my former life.
This is the NASCAR side of
you,
right?
I guess, yeah. Yeah, that's right. So I thought I was developing some type of inflammation of my blood vessels. It's called a vasculitis. I said to myself, well, this would be a good time to stop. And so I quit cold turkey after many, many years. As the weather got better and better and better, my hands got more and more discolored and cold, and I started to develop some aches in my chest, but otherwise feeling pretty good. I was working full-time. During this time, I didn't know retrospectively, I was dropping weight as well. And then when I look at old pictures of myself, I just look like, didn't look good. My eyes look sunken and you can almost see through them. But this was retrospectively. That summer, I went down to Washington, D.C. I presented at a conference, a pathology conference, and then went to the zoo with my family. The next day up, I was slated to come back to school, but I wasn't really scheduled. So I decided, I better get myself at least looked up. Let's get some blood work done. And so I called up my colleague and.
Because, by the way, there's a saying, it's probably very true, that doctors are very often the worst of patients.
Oh, my God.
Yeah.
100%.
Yeah.
Any other person would have done this about 6 months prior, but
Right.
I had every excuse in the world not to do this. So I got the blood work done. But before that, we went in for a chest x-ray, and they saw a 10, 11 centimeter mass in my chest that was proved to be kind of encasing around my great vessels, my heart. It was an invasive cancerous mass. It was proven to be a thymic carcinoma, not thyroid, but thymic carcinoma, which is a very rare cancer. Aggressive. Only, like I said, only a pathologist would come down with that.
Right, because usually, just for non-medical people out there, I mean, the thymus, usually it's around during, early life, and then it sort of goes away.
That's right.
So, yeah.
Yeah. And so in my particular case, it persisted and became cancerous. This was in 2017, so went through rounds of chemotherapy, lost my hair, lost a lot of weight, went through 3.5 months of radiation, went through radical surgery to take it out. And after about 6 months, I was complete with everything. And then 6 months later, the anniversary of my diagnosis, they found a recurrence in my liver. They also found a new cancer in my colon, which we call a second primary. So the colon was taken out.
How much, I know you're not somebody, I've never heard you curse, but how much cursing, or I don't know, what were your emotions at that point?
I was
disbelief. I mean,
yeah, I think it was a little disbelief. I was a little bit angry at God. I always felt like I try to do the right things, and it was bad enough to get one cancer that that went to my liver, a year later, but then to get a whole brand new second cancer in my colon. It was kind of unexplainable. I couldn't rationalize it. I had very bad weeks. Weeks that were hard for me, were probably harder for my wife and children. And
I just want to stick with that one point, because I think, I know Kareem is Muslim. He's religious. You're very active with your mosque. You're active with your church. I'm active with my synagogue. Listen, I mean, religion's a very personal thing. I've had situations, not like yours, but I'll just real quickly say, when my wife was pregnant with our last child, I had cardiac issues, and we happened to be out of the country. I thought I was going to die because I went into some weird heart rhythm. And then just maybe a minute later, my wife excused herself. She was, 6 or 7 months pregnant. She went into the bathroom, came out, said she was bleeding. And I literally looked up at this guy and said, God, seriously, back off. So it sounds like you had a somewhat similar
clearly
experience.
Yeah, I really did. It's easy to have faith when everything goes well.
Exactly.
But I think my wife points this out all the time, and I think she's really wise. There would be no concept of faith unless you did go through hard times.
Right.
And the other thing that she said is, relationship with God is like any relationship. It takes work. And, God puts us through these types of tests, not to punish us, but to kind of mature us and grow us up a little bit in order for us to be able to get through this and maybe to have a impact on other people. That's one of the big reasons why I share this story with my students. And not only do I share the story, but I share all my slides, all the images, the radiographic images, my slides. I just shared my blood work, my tumor burden in my blood. I share all of that, being completely transparent with all the med students, just so they understand that, there's a face behind all these tests that they're going to order, and there's a face behind all these biopsies that they're going to see, and there's a face behind all these x-rays and images that they're going to see as well. So, hopefully it's impactful to them. But essentially, I got half my colon taken out. The colon cancer was done after that, and then went on immunotherapy, and immunotherapy worked well until it didn't. And then this last summer, had a recurrence, essentially was kept on immunotherapy and put on another drug called a tyrosine kinase inhibitor. But essentially it's a drug to restart the immunotherapy and to make sure that the fertilizer is not good for these cancer cells. And I'm sitting here talking with you, feeling good, full of hope. Just took a blood test yesterday, and we're, believing for the best next week in that result, that it's continuing to go down. We had a tumor burden level of 60 in my blood in the beginning of the summer, and now we're down to 3.5. And we're looking for it to continue to go down. But I shared this story with all my colleagues, obviously, but especially our students, and now with you all.
Do you have any expectation or had ever thought about how you'd respond in a situation Like just were you surprised how you responded or not surprised or?
Yeah, that's an interesting question. I never actually reflected on that. I don't think anybody can prepare for something like that. I certainly didn't prepare. Again, I think, conveniently religious, to be honest with you.
That's very honest, yeah.
I'm just being completely frank with you. Religion was one of those things where, when I had time for it, when I had time for God, then, I brought God in. And if I didn't have time, then, God was not in. And, so I didn't have much of a foundation, if you will, to be prepared for something like this because during the first diagnosis and certainly during the second diagnosis of the recurrence and the new cancer, I fell apart. Now I rebounded quickly, but no, those weeks were very, very difficult. So I don't think there was any way that I could prepare for it, but there was ways that I could rebound.
And you have. I mean, we throw the word resilience around, and that's certainly been, you've lived that. I just have to, I would be bereft if I didn't mention this. There's a very close friend of mine and I'll mention his name, he won't mind at all, Bill Eisenberg, who I've known since nursery school. He just buried his son, Brian. And again, he's not going to mind that I mentioned this. In fact, I think he'll be happy. And I went to the funeral, and one of the speakers quoted a passage from Deuteronomy about God says, I set before you life and death, choose life. The speaker made the point that for most of us it's sort of an abstract thing, but for his son, it was a very real thing. And he proactively chose to live, to conduct himself, his family, he's got kids, and he purposefully, in terms of his religious affiliation and practice and in terms of his other relationships, made a conscious decision to choose life. And it sounds like you very much did the same thing, no?
Yeah, I think that you have to kind of make lemonade out of lemons. Yeah. And I think that also this whole idea of faith, it's one thing to say it, but it's another thing to show it. Yes. And I think by living the best way you can and being a good influence on those around myself, whether it's my family or my students, that's actually activating and showing God faith without actually saying words. Words can be cheap, but I think actions speak louder. And the other thing is that this has been, my relationship with the medical school has been just a real blessing. I mean, it gives me purpose. Identify as a medical educator. I think it would be a colossal waste that if I didn't share this experience with these med students and with anybody who wanted to listen. But I have to say that not only my colleagues have been great with me and the students have been just wonderful, but I have to just mention my doctors, and especially Dr. Nagashri Sitharamu. She has really been part of our family for the last 8 years. I'll embarrass her probably right now by saying this, but she showed just as much concern when I got a recurrence this summer. She called up my wife to check on her and my son, and it moved family so much that she did that that we're forever indebted to her. I have a wonderful support team around me and also religiously. I think one of the bright things that came out of this whole thing is giving students the opportunity to learn from a person that's going through it. And I think the other opportunity is that I became a little bit more, let's just call it spiritually mature. Okay. I'm not a convenient believer in God,
It's like, what have you done for me lately? Like the Eddie Murphy. You just mentioned your doctor, and I need to bring up another part of the conversation we had beforehand. You mentioned the value of the nursing staff, and then you told me a story about one of the physician assistants. Not to take anything away from your doctor, but most of the time you spend is interacting with nursing staff.
I just had treatment yesterday, and I was kind of reflecting on that. I speak to my doctor and occasionally see her, but I would say 90% of the time I'm with the nursing staff, the PAs, all the techs. But especially when you're getting treated, the nursing staff is really first and foremost. And essentially, they are the ones responsible for making me feel comfortable. They activate my port. They sit and talk. They're incredibly professional. They have to, make sure all the blood goes in the right way and taken the right way. And, there's a tremendous responsibility they have. And make me feel like a human being, and that they're caring for me. So they're a really professional bunch over at the Zuckerberg Cancer Center. I'm indebted to them. They've always been that way. I make it a point not to really advertise that I'm a physician or that one of the deans at the medical school. I really make it a point just to be David there, and all the patients that I see regularly there know me as David, and I think most of the staff, I think they probably know who I am, but never make a big deal out of it, and I don't want it that way.
So did that change for you, though, like before this whole experience that you had? Because you were saying before that you had sort of like a spiritual awakening, right? So that was something that had changed. What about your perception of the value that nurses bring to the bedside? Did that also change?
Or? Oh, 100%. Yeah, because it really came from ignorance, right? If you're not a patient, you don't really understand how that health system works. The systems-based practice, how that actually works for a patient, right? You think you're going to go to your doctor's going to treat you, and that's that. But, a big part of my success has been the nursing staff. So it's completely changed the way that I view not only the nurses, but the PAs, all of the techs. Without them, I wouldn't be here. I mean, it's as simple as that. There's a tremendous responsibility for the nursing staff to adhere to the process, to give every patient the best chance of life. I'm forever indebted to them. I mean, I can't speak highly enough of the professionalism of the nurses over at Northwell, especially the Zuckerberg Cancer Center. I've been in all parts of Northwell, because with every single treatment, there's a million side effects. So there was a million departments that I've been a part of, and I can comfortably say I haven't had not one bad, negative interaction with any of the staff. They've just been blessings.
And that's incredible. First of all, just, the tipping your hat to the nursing profession, and, you could take credit on behalf of your
I think
colleagues.
You can take some credit for that as well, because you're a big part of that.
I try not to advertise that too much, but that just goes to the point of the professionalism. Being an oncology nurse, especially, because that's who I'm really dealing with most of the time, they have so many buckets that they have to do perfectly. Yeah, and at the same time, to have a smile on their face and make the patient feel comfortable. And it's just mind-blowing to me, the professionalism and just the care that I get over there. And I honestly would not be here without them.
Hey, look, it's wonderful to hear, because it's no secret that there's a lot of problems with a lot of healthcare. That's just the way it is. So for you, without going in as a VIP, to be getting the kind of treatment you're describing is, incredible. So shout out to Northwell.
Well, right, and the nursing staff at the at the Zuckerberg Cancer Center. Listen, I'm not the only patient there that they have at that moment, right? They might they might have 5-6 patients that they're attending to, all with a lot worse off than me.
Right.
Yeah, I'm just in awe of their professionalism. I really am.
I think that God doesn't burden a soul beyond what they can actually bear. Mm-hmm. And you yourself have been a mountain of a man. You basically carry the med school on your back, the school of nursing on your back, so many different departments on your back. And despite the challenges that you've had with your health, I've seen you working. How do you manage that?
Right. I work with incredible colleagues at the medical school. I'm just one person pulling that cart in the same direction as all my other colleagues. So, I'm indebted to them. They've supported me in so many different ways that I'm able to do what I love and to work. The reality is I don't have many outside interests outside of medical education. That's just the reality.
All right.
I love doing the consulting work. I've done a lot of work down in Texas, and our church is down in Houston, and so we're down there a lot. But actual everyday hobby. I'm not a golfer. I just don't have that many hobbies.
There's still time,
Right. Yeah, no, I know. My son golfs, and he's just terrific at it. But I just don't have many outside interests. So I identify myself as a physician, as a medical educator. Mm-hmm. I have joy when I'm doing that. Yeah. Whether it's with the nursing school, for those years that I, was just one member trying to create something special over there, or trying to create something special at the medical school, or especially, in the classroom with our students. You're going to feel sick whether you stay at home or you come to work. Yeah. Right. I'd rather come to work and feel sick or tired than just stay at home and just watch TV or just fall asleep on the couch. Mm-hmm, mm-hmm. It's just a conscious choice. And the other point that I wanted to make is, this goes back to the faith thing, is that, I don't think I can say that I'm a man of faith and then sit at home and just wait for something good to happen. You almost have to make your own success in a way. And I think that, if I'm at least doing my part to be an active, productive member of society in the medical school, then that's me releasing my faith.
Yeah. And look, I could bear witness, and Kareem can. I mean, I've seen you in your happy spaces, the structure lab, it's like, wow, that's a happy place for you. And the Pearls room is a happy place.
The large group rooms.
Talking about Pearls is a happy place.
Talking pathology, one of my favorite parts, I just got done with the structure of cancer block, that I was the main structure lecturer. And I have to tell you, it's my favorite part of the year, because not only does it interest me, what I'm personally going through, and all the molecular nature of disease and the cells and how they grow and why they grow certain places and not others, but also being able to put a face on, a disease that affects so many people. I feel really blessed about that and honored that, God's entrusting me to do that.
You've written, given interviews and whatnot at various points. There's a literary magazine over at the med school called Narrateur, and you spoke about relinquishing control.
Well, that might be one of the hardest things, because I'm still trying to control my disease as we speak. Everything that I do, am I controlling this disease? Listen, you guys know, as doctors in the healthcare system, I mean, you wouldn't be as successful as you are unless you controlled something, right? In other words, you controlled your learning, you controlled, in a certain degree, your outcome, and that's why you're successful. So physicians, by nature, are controlling people. I say that with a smile.
You
everybody
said it, not me.
Right. But we like to be in control. And
so my wife was here, she'd be nodding her head.
No,
vigorously.
No, and in my particular case, as a pathologist, when you're the person, either teaching about disease, or you have to be perfect about it. So there's a certain amount of control, and cancer is one of those things where you don't control anything. Cancer is basically in the driver's seat. And at some point, you have to kind of relinquish. There's many examples of this over the last 8 years that I had to go through where, I'm just going to trust what my doctor says. I'm going to trust what my PA says. I'm going to trust what my pastor says. I'm going to trust what I'm feeling or how God's talking to me. I'm just going to trust it, because there's some things that I can't control, and if I just give it to God or the expertise of my physicians, then that actually allows me to do what I love to do and be hopefully a good role model and mentor to med students.
A couple of times we've mentioned NASCAR, and I'm going to mention it again because, I think a lot of people, including me and Kareem, know that you're a devoted NASCAR fan. So how did that come about? And just, to sort of try and make this dig in a little bit, is there any relationship at all between sort of a driver, NASCAR crew, and doctors and patients?
I kind of grew up with it. I mean, as a little kid, we used to watch Dale Sr., Jeff Gordon, Bodine, all those guys in the 70s and 80s driving. I kind of grew up with it. And so, we've gone to 20, 30 races around the country, and we just really enjoyed it. It's a whole weekend festivity, right? It's not just one race. It's like 2 or 3 races. We've met our drivers. Our family favorite driver is Jimmy Johnson. We met him a couple of times. In fact, when I came down with my disease in 2017, it was a very low point, and a student emailed me a beautiful email. And at the very end, she said something to the effect of, I was trying to look up some inspirational Jimmy Johnson quotes, but I couldn't find any. So I guess he's a man that kind of speaks for himself on the track and the way he lives his life. It was just a beautiful thing.
Wow.
Just a beautiful thing. And my wife, Stephanie saw that email, and unbeknownst to me, she mailed that email down to his foundation. A week later, I was on a walk with my son, and Jimmy Johnson gets a hold of me and had a beautiful video encouraging me and my son
great.
Jack and really rooting us on. And so we got a chance to meet with him twice after, right before the race. right outside his trailer, and he's just been a real blessing and an inspiration to us. You know, like anything else, and you guys know this just as well as I do, in the healthcare system, systems-based practice only works as well as its weakest link, right? So in other words, the reality is that, you know, I'm blessed with a system that has no weak links, and that's the reason why I think I'm sitting here talking to you, along with the grace of God. Same thing with NASCAR. You know, I was just watching the race. You know, the driver is only half the equation. The car is the other half of the equation. The pit crews, I know there's not three halves, but you get the point. The other half of the equation, the favorite ended up losing, not because of his own doing, but because his clutch or his tire went down. So there is some similarities.
All right. Hey, listen, how often do you get down there? I mean, it's a whole different lifestyle down there.
Yeah, well, you know, our spiritual headquarters, if you will, I mean, you know, God is everywhere, and, you know, we pray everywhere, but, you know, we're members of Lakewood. Pastor Osteen is our pastor, and, you know, his brother Paul is our pastor as well, and, you know, Paul is a physician and co-pastor. Yeah, he's a surgeon, and so he's really helped me through this ordeal, really encouraging, sending me notes and messages and praying for me. And, yeah, we're indebted to them quite a bit. They've been a tremendous source of inspiration and support. And teachers, right? I mean, you know, a relationship with God is a relationship. And they've been really, really good role models for us.
It's interesting because a lot of people that are in the sciences and the medical field, there's like this loss of a belief in God, right? And I think that you being a pathologist, I think you can relate to this, that you just look at the way the body functions, and it has to have a designer, it has to have someone who had intent to make it work the way
I have to say, being a pathologist is not a blessing when you have a disease like this. It's not a blessing.
No, too much.
Everything I overanalyze, and that's the complete opposite of faith and what God can do for you. And so this has been a constant, in fact, I just was struggling with it this weekend. You know, it's been a constant struggle, but I've been reminded that, you know, without struggle, there is no growth. And this is all part of the plan. Yes. In order for me to get closer to God, it's to go through the struggle. Absolutely. If there was no struggle, then I would need to get closer. So I understand that, but it's difficult. It's really difficult, especially as a pathologist. It's very, very tough.
You know, and look, I grew up religious, and Kareem as well. I've said this often. You read the Bible stories, or you learn them growing up, and it was like, oh yeah, okay, this happened a long time ago, and it's abstract. And then you find out this is real. The challenges and the trials and everything else.
You know, I've always been religious, but, you know, like I said, a convenient believer. I don't think God was happy with that. And so, you know, sometimes he allows things to happen in order to, I think, really spiritually mature us and to get us to the next level. I would say that I'm grateful for everything that's happened over the last 8 years. And I see, interestingly enough, a little bit more good than bad. I'm very, very thankful.
This has been a wonderful conversation, inspirational for me, and then I'm sure I'm speaking on behalf of my co-host, Kareem. Yeah. So just to close out, I mean, if you could summarize, you know, your philosophy of health and life and, you know, healing in one sentence, just some final thoughts.
Yeah, I would just say be thankful for your entire healthcare team, including your doctors, your nurses, your PAs, their expertise, all the techs. I think to have a heart of thankfulness is very, very important, and we should never dismiss that. I'm thankful for my family, my wife, Stephanie, my son, Jack, my other children, Eric, Katie, Lori, Kelly, my entire family. Thankful for them. I'm thankful for my coworkers, my colleagues, that's given me the opportunity to still work during some very, very tough times and be really supportive. I'm thankful for my learners, my students. I'm just thankful to be here. I'm thankful to God. I'm just thankful to be here. And I just think that you have to just have a spirit of thankfulness and just try to live your life in an excellent way.
Yeah, listen, thank you again. I mean, it's tremendous words of wisdom and inspiration. So thank you.
And you know what? We're thankful for you. For you to say all of that, we're thankful for you.
Yeah, well, it's my pleasure. I'm looking forward to working with you guys more, getting my long-awaited tour around the nursing and PA school. I haven't seen the building yet, but I hear it's beautiful.
We look forward to that. So listen, on behalf of my co-host, Dr. Kareem Nugdalla, you know, with great thanks to you, Professor Dr. David Elkowitz, always with the wonderful support of John Mullen, our station manager and chief engineer. This has been another episode of Nurse to Health, produced in collaboration with the Hofstra Northwell School of Nursing and Physician Assistant Studies, where we bring you behind the scenes and to the front lines of healthcare. Until next time, stay well.